So in this video, I wanted to talk about the risk and complications that come along with breast implants. This is just a disclaimer. This video is not to scare any of you or discourage you or stop you from getting or wanting to get breast implants. This is just strictly informational, and it's been requested that I make this video. Also, I'm not against, if anyone hasn't seen any of my other videos, I'm not against breast implants. Just throwing that out there before I get started. So in no particular order, I'm just going to lay out risk, or I guess complications that come along with it. So the first being bottoming out. Okay, so what it is when the implant drops lower than it's meant to be. Like it falls below where the crease is, and it causes the nipple to kind of appear to point upwards. It can happen in one or both. It generally happens to someone who is thinner and who has less breast tissue to begin with. It also is more common in women who choose to get implants over the muscle as opposed to fully under the muscle. It's caused by either the implant being too heavy and I guess kind of pushing itself down. So this is why you don't want to go with an implant that's too big for your body or too bigger than the doctor suggests. Or it also happens from over dissection of the implant pocket from the surgeon. Either way, it can be corrected by the doctor going in and kind of like resuturing underneath here to kind of like raise the crease back up. And I'm not saying don't do it over the muscle, I'm just letting you know, because it can happen under the muscle too. It does happen that way. It doesn't make a difference whether it's saline or silicone. I don't believe one type of implant is more susceptible to it than the other. The next thing is capsular contracture. Okay, so this is the most common complication or risk that comes along with breast augmentation. What you should know is that whenever you place a foreign object into the body, for example, an implant, the body's natural reaction is to form a scar tissue capsule around the object or the implant, blocking itself off. It's just like a protective thing. Okay. Normally, or ideally, the pocket that the surgeon made will still stay open and allow the implant to move freely. That's what the whole massaging thing is about. Like because you can get capsular contraction at any point in the healing process, but it's more common to happen in the first few months after surgery, which is why some doctors, I know my doctor, is so adamant about doing massages like from 1 year for the rest of your life, to do massages every day, at least once a day. So I know I'm personally am like paranoid about doing it because that's what I'm afraid of. So squeezing the implant up and down keeps this pocket open. Obviously my boob doesn't need to be all the way up here near my collarbone, but if I keep squeezing it, it kind of ensures that the implant can move up and down and remain its natural shape. If I didn't do that, then I guess I could possibly giving it more of a chance for the scar tissue to harden, and that's what gives capsular contracture this hard appearance. It makes, see how it looks kind of like a ball in her chest, like, and it just kind of distorts the appearance of the breast and makes it hard. Yes, capsular contracture is common within the first few months, but it doesn't mean that you can't get it later on. Like, I have talked to someone who had her implants for 5 years before she got it, so it's kind of scary to think that you're not really ever in the clear for it. I don't think they know for sure 100% what causes this problem, but these are things that I guess increase the risk of having it. So germs getting into the pocket like during surgery can, I guess, make you higher risk for this, which is why this is more common in women who chose to have silicone implants, because whenever when you have silicone implants, the implant is pre-filled, unlike saline. So with saline you can make a small incision and stick in the folded up implant and then fill it up on the inside, so there's no friction. But with silicone implants, You make a little bit larger incision, but it's still not as large as the silicone implant is, so you make friction to get that implant in the hole. And where there's friction, there's possibly bacteria, which is why they have the Keller funnel to kind of prevent that, but still there's no way to avoid it completely. So, like I said, it is a higher risk with silicone implants. I'm not sure the percentages, so that's one reason. Getting the implant placed above the muscle also puts you at a higher risk for capsular contracture. I'm not sure why the reasoning is. Again, that's not saying that girls who have them under the muscle can't get it. Let's just call it CC because this is a tongue twister for me. Girls that get it under the muscle, I'm not saying they can't get CC, but it is a higher risk to get it above the muscle. You're also at higher risk for CC if you are a smoker. But then again, also I'm not saying all smokers will get CC, but it does put you at a higher risk. Alright, so hematoma is basically when you get like a pool of blood in the implant area. Sometimes it forms a almost mass and it can be painful. Sometimes it goes away on its own, but other times it doesn't and you'll have to go in and get it drained. This is why your doctor may or may not have told you to avoid certain medicines like aspirin or ibuprofen. My doctor told me to avoid like protein shakes and vitamin E because these things thin your blood, which it's not a good thing. It keeps your blood from being able to clot. And the last thing you want is to be excessively bleeding after surgery because that'll lead to infection, which goes back to the whole capsular contracture thing. So, yeah. Okay, so the next thing is double bubble. And double bubble, it looks like this. And basically, as you can see her original breast crease and then the new crease of the implant. This can be caused by if you should have gotten a lift but didn't for whatever reason and you got the implants placed below the muscle, so then you're going to see your old breast crease still basically sitting on top of the implant. This can be avoided by either getting the breast lift that may or may not have been recommended or by getting the implant placed over the muscle. So yes, you're at higher risk of double bubble if you get the implants placed below the muscle. You're also at a higher risk if you got surgery done via transaxillary, which I did, which is through the armpit, or through tuba, which is through the navel, because they're both like at a far distance from the actual breast, so basically at a higher risk of placing the implant up too high. In some people, it will resolve itself on its own. Like some people have tight skin tissue, so once the muscle relaxes, the implant will drop down where it's supposed to be in some cases. But other people really do have to go in and either get that lift or get it changed to go on top of the muscle. Another risk would be silicone poisoning. Now, you would think that this would just be the case with silicone-filled implants, but it happens with silicone and saline implants because saline implants have a silicone shell. So basically what happens is, I guess, fine particles of the silicone bleed into the body or whatever. This can also be a contributor to capsular contracture. Basically, the silicone poisoning will cause other issues, like you may feel tired or fatigued, see weakness, large lumps or masses, discoloration of the breast, swollen breast, autoimmune deficiencies, and so on and so on. I'm not going to say it's rare, but I will say that this is less common. Either it's going to happen to you or it's not. Same thing with all these other things. And I guess the way to fix this problem is to have the implants removed, unfortunately. Alright, next is extrusion. Extrusion is when the implant comes through the skin. I know it sounds horrible and it doesn't even sound real, but it is, and I've seen pictures. I'm warning you, I'm about to put up a picture now. Yeah, so it does happen. It can happen when the skin weakens and the implant can start to come through, or happens if the wound doesn't close all the way. And apparently, radiation therapy can, I guess, increase your likelihood of this. But if it does happen, then obviously you have to get the implant removed or replaced, because you can't have the implant be exposed to air, and it'll also cause furthering scar tissue. The next thing would be necrosis, which is when your tissue dies. Basically, your breast tissue dies, and this can cause the incision from being able to close, which can cause extrusion to happen. People that are high risk for this, also people who are going through any kind of radiation treatments, and smokers as well are at a higher risk for this. So both necrosis and extrusion are more rare complications. Most people don't really have that, but it can happen. Anything can happen. Keep that in mind. Rippling, where you can see like folds or wrinkles in the actual implant, and there's this misconception that only saline implants have this, but it happens with both implants. And it can happen with implants over or under the muscle, although it is less noticeable when you have it under the muscle, because first you see your breast tissue, then the muscle, then the implant. So any rippling appearance will be less noticeable under the muscle. You're at a higher risk if you get it over the muscle, and if you are relatively thin, because you have less breast tissue to start with to kind of conceal any rippling. This can be prevented by like if you get saline implants and get them overfilled, so that the implant itself is not so loose in the shell, but then the implant will be kind of harder but not too hard. Like I said before, one of mine is overfilled, this one I believe, but this one is not any harder than this one is. Only reason I had to do that is because starting out this breast was smaller than this one, but now they're even, I think, yeah. Also puts you at a higher risk of this is if you have a textured implant, because the traction of it against the muscle, or like if you get under the muscle or whatever, can cause a wrinkle in the skin. Rupture or deflation. Okay, the percentages of this are higher with saline implants. Well, if you don't already know, you should know that implants are not a lifetime thing. I mean, if you get it done once in your lifetime and they last you forever, consider yourself lucky or whatever. But getting implants, I knew it's not a one-time thing, and that down the line, generally 10 years, I guess they say, I'm going to need to get them again. But anyway, you'll need to replace them. Some people will need to replace them, especially with saline, because of rupture. Both saline and silicone implants are susceptible to rupture, but the percentages of rupture are higher with saline, because it's harder to detect a silicone rupture. So that's not saying that it doesn't happen with silicone, it's just that it's less reported, because a lot of women don't get the MRIs that they're supposed to do, so they're not detecting the ruptures. But with saline, it's obvious if you have a rupture, because you'll wake up and you'll have one boob pool and the other one boob will be flat, which may sound like a bad thing to some people, but to me, that's the reason why I chose to go with saline, because I want to know if my implant is leaking into my body, and I'm okay with it just being salt water, as opposed to having it be silicone and not even knowing that it's leaking into my body, and it's still keeping its form, and the silicone's not just going to absorb in your body like saline would. And once again, I'm not trying to persuade you one way or the other, I'm just letting you know how it is. Rupture can be caused by, I guess, like any kind of trauma, like say you get in a car accident and maybe you like slam your chest into the steering wheel or whatever. Or sometimes with saline implants, I know there's a phenomena called, I can't think what it's called, but basically it's where the implant folds on itself, and over time it just kind of rubs until it creates a hole. Which is why I'm still not sleeping on my stomach, because I'm kind of paranoid. For one, it's uncomfortable, and I'll go over this more in my 6-month update video, which I will be posting soon, but I won't be 6 months until the 26th of this month. So anyway, too much friction of the implant itself can cause a hole and deflation. So to fix deflation or rupture, obviously you have to get your implants replaced. but they have warranties. Like I got, you know, lifetime implants for free, basically. Well, the implants themselves are free for replacement, but obviously the surgery won't be free. So that's another risk, not risk, but complication, but thing to be aware of is a lifetime of spending money. Yeah. Loss or change of sensation. You can expect like some tissue damage, so then you might lose sensation. Now this can be permanent or temporary. Like I know with me, where before surgery I didn't have a lot of sensation in my nipples, but afterwards it was a lot, to the point where it was uncomfortable and I didn't like any fabric rubbing up against me. Luckily things are back to normal, and that doesn't, it's not an issue to me. And then I also went on the reverse of that, where the actual, like my actual areola, I didn't have any sensation at all. Like I could touch and I used to not be able to feel this at all, but now that's back. And honestly, and like I said again, I'll mention this in my 6-month update, I don't have much sensation over here. I don't have this in this area, just because before I got implants, never used to have boob right here. So basically, this is all implant that I'm touching. So yes, I can feel myself touching my skin a little bit, but not so much as I can feel it like here or whatever. Just something to be aware of. I'm only not even 6 months out yet, so things will keep changing. So be prepared to be more sensitive, less sensitive, no sensation, or no change at all. Just keep that in mind. Symastia. Symastia, it looks like this. And as you can see, the implant looks like it is like almost a uniboob pushed into one. The skin is lifted, and it's like too much cleavage, like there's no separation, like the midline is lifted up from the chest. This can happen from over dissection of the implant pocket, like during surgery. So the implants start to shift. This is more common, I believe, for people who get transaxillary incision like I did, because the doctor can't really see where they're going, so they have a better chance of making the pocket too big. So I would not recommend going to a doctor that does not specialize in this incision point. Dr. DeWire, the surgeon that I chose to go to, and I chose him for this reason because I saw that he specializes in that incision point, and that's what I really wanted. Doctor, if that's not his first choice of incision, either choose another doctor or have your doctor do it his way, because you don't want to make that risk. This can be fixed by wearing a thong bra, which looks like this. Basically, it just kind of compresses down in the midline, pushing the implants back to where they need to be, or getting reoperated on and have them kind of suture up the pocket, making it more appropriate for the implant size. Mondor's cord. Apparently, according to justbreastimplants.com, Mondor's cord is inflammation of a blood vessel. It isn't a risk per se, and it heals on its own. I believe that I experienced this, although I never really asked my doctor, but just based off of what this says, I think that I had this in like the first, before I even hit like 1 month, or maybe right at 1 month. It's a visible vein, but it resolves itself. I believe I had mine like near my armpit, because I remember not being able to lift my arm. Like when I lift my armpits, there was like a tension, but it did go away. So some people get them there, or wherever they're, or right in the crease, normally wherever they got their incision done. But I think it's less common with those who got periareola incisions. Unsatisfactory results. With anything, whatever kind of surgery it may be, or even if you're just dyeing your hair, you may not like the way that it turns out, or it's not what you imagined. But you have to try not to get caught up in your expectations, and know that, if you don't like what you get the first time, you're going to have to get them done again eventually. So know that maybe next time that you'll have them be the way you want it to be. Now this usually is because of size or shape when it relates to implants. Some women think that they got them too big, but most of the time, some women think that they are too small and wish that they have went bigger. And then some people aren't happy with the shape of the implant, which is why I just recommend just do your research on things. Understand that if you want that really, I guess, rounded look, like you see how mine are rounded up here, upper pole fullness, know that you probably can't get that with silicone implants. I'm not saying it's impossible, but this is a characteristic of saline implants. Silicone implants are, known for having a more natural feel, I guess, and they're more like breast tissue, so they're going to sit like breast tissue. Same thing goes with the reverse. If you want really, really natural looking breasts and you get saline implants, don't be surprised when they are particularly round and you don't like that. Don't get your hopes up about size either. Know that you can't start out having nothing and go to like gigantic. It's just not going to happen. Your skin has to stretch. If you're starting out in A cup, don't think you're going to be able to get 600 cc's on your first surgery. Maybe your second surgery, but the first one's not going to happen. Like, even in my mind, and it sounds crazy to think it now, and I had no idea how many cc's I was going to get before I went under. I just trusted my doctor to do what fit, or to do what he could. He asked me if I was afraid of him making me too big or too small. I told him I was afraid of him making me too small, so I guess he put in the biggest implant that would fit my frame. My idea of what I wanted is actually not what I wanted, I guess. I thought that I wanted about 400 cc's, which is a lot. It really is a lot. I mean, I ended up with 250, and look at what that got me, but this doesn't, 250 cc's doesn't look like this on everyone. 400 cc's would have been gigantic, basically. Also, to prevent from being disappointed in the size that you get, bring in a picture of what size you would like to be. Don't say cup size, because cup size is relative. I feel like people think D and think, oh my god, that's huge. I'm a D. Sometimes, depending on the bra, I'm a double D. The bra I have on now is a double D. But I don't look like that. A 32D is the same as a 34C, which is the same as a 36B. So, bring in a picture. Don't tell your doctor, make me a C cup, and then when you get it and think, oh my god, I still don't really look any different than I did before, then you'll know why. But anyway, ladies, that's basically it. Once again, this was not to scare anyone or deter you from getting implants. I just figure, everything you do has a risk. It's nice to know about what the risks are. I may not have covered all the risks, but these are just the ones that I have come across and figured I'd want to share with you. Maybe that'll help you decide what type of implant you may want to go with. Weigh out the factors of each, weigh out the risk of each. This kind of sounds like my silicone versus saline video, which if you haven't seen, I will link below. Subscribe to be updated with other information that I'll be posting, like my 6-month video that I'm doing soon. If you have any questions about my surgery, I usually always list information below, from when and where, how much, the doctor, and stuff in the description box below. Thank you for taking the time to watch this video, and I guess that's it, and I'll talk to you ladies later. So how do you feel? I just got back from the surgery.